compulsive behavior (OCD) is an anxiety disorder, social agoraphobia and social phobia, characterized with instructive thoughts, recurrent, persistent, with produced uneasiness, apprehension, fear or worry, and repeated behaviors, all compulsion towards reducing the associated anxiety. A person with OCD realizes he has a problem. Usually, his family and friends also notice it. Patients often feel guilty of their abnormal behavior, and their families also get mad sometimes, because they are not capable to control their compulsions. In other cases, in their need to help them, they can pretend have symptoms that aren't real, justified, or even help with the rituals. Action is considered counterproductive. Among the OCD, the most common types can be differentiated: washers and wipers shakers, somatic and hypochondriacal shakers, repairers, organizers, mental ritualizers, paragraph philosophers, tormented and pure obsessive perfectionists, superstitious, magical thoughts, compulsive askers, hesitant and indecisive, and accumulators, called insignificant objects from which they can detach. That last is denominatory compulsive hoarding or pathologic collecting. It's a pattern of behavior that is characterized by the excessive acquisition of anti-value or unwillingness to discard large quantities of objects that cover the living areas of the home and causes significant distress or impairment. Compulsive hoarding behavior has been associated with health risk, impairing functioning, economic burden, and adverse effects on friends and family members. When clinically significant enough to impair functioning, hoarding can prevent typical uses of space that limit activities such as cooking, cleaning, moving through the house, and sleeping. It can also be dangerous if it puts the individual or other at risk for fire, violence, poor sanitation, and other health concerns. Compulsive hoarding in its worst forms can cause fires which identify symptoms by symptoms. Compulsive hoarding in its worst forms can cause fires, including conditions, for example, rat and roach infestations, injuries from tripping on clutter, and other health and safety hazards. A few symptoms a hoarder might experience are: 1. Tend to hold onto a large number of items that most people would consider not useful or valuable. For example, junk mail, old catalogs and newspaper, things that might be useful for making crafts, clothes that might be worn one day, broken things, trash. 2. The home is so cluttered that many parts are inaccessible and can no longer be used for intended purpose. For example, beds that cannot be slept in, tables that cannot be used for dining, chairs or sofas that cannot be used. 3. The clutter and mess is so bad it causes illness, distress, and impairment. For example, keep the shelves drawn so no one can see inside, get into a lot of arguments with family members about the clutter, are at the risk of fire, flooding, infestation, or eviction, feel depressed or anxious much of the time because of the clutter. Next, I want to show you two histories of hoarders. Here they are.
My name is Jennifer, and I'm 27 years old.
What's in your mouth? Candy?
Well, my house is a mess. It doesn't feel like a home. My porch is sort of the catch-all for things that we can't fit into the house. And then you come into the living room, and the floor's pretty well consumed. And the kitchen, you know, the sink is an old slop sink, so water spills out of it frequently. There's a lot of spills that don't get cleaned because there's stuff on the floor. The hallway is our laundry hamper. There's always a carpet of laundry. Getting down to the basement to do laundry can be hazardous. And the kids' rooms, that can probably be at times some of the messiest place in the house. It's awful.
Onion. My name is Jill, and I'm 60 years old. I've been a messy person all my life. I hoard food. I feel guilty about wasting something that somebody could be using. I use duct tape to close the freezer door sometimes when I've got too many things in there.
My name is Kathy, and Jill is my older sister. The food in Jill's house is just really scary. It's because it's everywhere.
Therapeutic intervention. Cognitive behavioral therapy (CBT) is a commonly implemented therapeutic intervention for compulsive hoarding. As part of cognitive behavioral therapy, the therapist may help the patient through discovering why he or she is so compelled to hoard, learning to organize the possession to decide what to discard, developing the decision-making skills, the clearer the home during in-home visits by a therapist or professional organizer, gain and perform relation skills, be open to trying psychiatric hospitalization if the hoarding is serious, have periodic visits and consultations to keep a healthy lifestyle. This modality of treatment usually involves exposure and response prevention to situations that cause anxiety and cognitive restructuring of belief related to hoarding. Furthermore, researchers have also shown that certain CBT protocols have been more effective in treatment than others. CBT programs that especially address the motivation of the suffering, organization, acquiring new culture, and removing current clutter from the home have shown promising results. This type of treatment typically involves in homework with the therapist complete with victimization homework, the completion of which is associated with better treatment outcomes. Research on internet-based CBT treatments for the disorder, where participants have access to educational resources, cognitive strategies, and chat groups, has also shown promising results both in terms of short and long-term recovery.